everyone, and welcome to today's webinar, Sparking COVID-19 Vaccine Confidence in Students of Windsor Essex, a webinar hosted in collaboration between the We Spark Health Institute, the University of Windsor, and St. Clair College. We are happy to have you all here today, joining us in on this webinar and joining in on the conversation. Next slide, please. To help introduce us of who we are today, I'd like to introduce myself. My name is Dr. Dora Cavallo-Medved. I am a learning specialist professor in the Department of Biomedical Sciences and also the Translational Research Director of the Windsor Cancer Research Group. With me today is my co-host, Nellie Bourdignon. She is the president of the Science Society at the University of Windsor and an undergraduate student in biomedical sciences. Both of us would like to welcome you to today's webinar, as we will be hosting our panelists today and starting that conversation, engaging you in talking about COVID-19 vaccine confidence. Next slide. So for your best experience today, we ask that you keep your mic muted, and that if you have any questions, and hopefully you will have some questions as well, that you will put them into the chat for our panelists throughout the webinar, and we'll be getting to those questions as we progress through. We also would love to get your reactions to the questions that are going to be posed for you throughout this webinar as well. And just as a note, today's session is being recorded. Next slide. And to begin today, I'd like to first acknowledge the traditional, ancestral, and unceded territories of the Three Fires Confederacy of First Nation, comprised of Ojibwe, Ottawa, and Potawatomi. It is the territory in which We Spark Health Institute, along with the University of Windsor and St. Clair College, sits, and where we are fortunate to be delivering this workshop for you today. Next slide. So now that you know a little bit about myself and my wonderful co-host, we'd like to know a little bit about you. So we thought we would do a little interactive session to get us started today, and letting us know where or what best describes you as you see here today. So are you a student from St. Clair College, a student from the University of Windsor, or maybe a high school student or non-student member of the Windsor Essex community? You can use your icons down below under the reactions tab there to show us which one of these best describes you here today. So go ahead, let us know who you are. Great to see that. Love to see all those interactions. All right, so now that we know a little bit about you, let's talk a little bit about what we are hoping to do here today through this webinar. So to introduce us as an organization, the We Spark Health Institute is a relatively new organization within the Windsor Essex community. It is in fact an innovative partnership between Hotel Dieu Grace Healthcare, St. Clair College, Windsor Regional Hospital, and the University of Windsor. We work together to bring research strengths, health research strengths, I should say, enterprise and infrastructure across Windsor Essex. We are working together to establish research pipelines in the areas of health, and so addressing those health issues, advancing discoveries, innovation and technology, as well as training and promoting excellence amongst our healthcare professionals, as well as our trainees, our students that are here on today, and engaging the community in health research. Next slide. And so with the Health Institute, we are here today to bring you three major goals. Number one, to build confidence in the COVID-19 vaccines. And this is very important because, as we all know, there's a lot of information out there about COVID-19 and those vaccines, and information is changing rapidly. And so we're here today to help answer some of the questions that some of you may have regarding COVID-19 vaccines, and hopefully build that confidence in the vaccines that we do have to combat COVID-19. We also hope that this environment is a safe environment that you can pose questions and get answers pertaining to the COVID-19 vaccines, and join that discussion as well. And hopefully by the end of this session, we will have been able to break down some of those barriers that students and young adults may be facing in Windsor Essex in an effort to help promote their vaccinations and to get them out there and get vaccinated. Next slide. So today's webinar is actually part of a larger research project that is together in collaboration between the University of Windsor, St. Clair College, and the WeSpark Health Institute. The project is a nationally funded project through the Natural Sciences and Engineering Research Council and has 4 major objectives. Number 1, to identify what the drivers of vaccine confidence are and what are the hesitancies specifically in the students and younger populations. Secondly, to focus on the perspectives of racially and ethnically diverse populations. Third, to build evidence-based practices so that we can address these barriers in an effort to build vaccine trust. And finally, to work with our community partners within our campaign. We're hoping that this webinar will address some of these particular objectives and an effort to educate those, particularly in the student and young populations. Next slide. Our team is made of a multidisciplinary group of individuals, myself, along with my co-investigators, Dr. Sarah Woodruff from the University of Windsor and Monica Teague from St. Clair College, in collaboration with WeSpark Health Institute and their staff, Karen Metcalf, Adriana Grande, and Ryan Palazzolo, as well as a group of wonderful students, both from St. Clair College and the University of Windsor. And I should say that these students really are the leaders of this particular campaign and this particular projects. They are at the forefront of building COVID-19 vaccine confidence for all students and young adults across our region. So I want to thank them right off the bat for all of their work in helping us build this campaign. Next slide. And so as part of our project, our initial objective was to begin to identify what are some of the drivers for vaccine confidence, and in particular, what are some of the vaccine hesitancies. To do that, we ran a survey in the early part of the semester, so September, across the University of Windsor. That included both students, faculty, and staff, asking about what their COVID-19 vaccine hesitancies are. The survey, which encompassed over 1,500 participants, so 1,624 is the number there. When we look at the demographics of those who completed the survey, the median age was 27, which fell right into that age category that we are particularly targeting. If we look at the student participants in particular, we had 49% of the students are undergraduates at the University of Windsor, 21% of them are graduate students. In the next slide, we're going to be talking a little bit about what some of the hesitancies are that came about from the survey, but I also wanted to mention first that the survey is now launched also at St. Clair College for those students, faculty, and staff, and it is ongoing over the month of November. So we're hoping to get more data collected from that survey as well. But if we go over to the next slide, what we're going to see are some of the major or some of the top vaccine hesitancies that were identified amongst the student population within the survey itself. And as you can see, probably a lot of them are things that you've probably heard already. Things like, I feel like my natural immunity is sufficient enough to be able to combat the virus in COVID-19. Or I've already had COVID-19, so therefore I feel I'm already protected and don't need additional protection through vaccines. Many students also did face some physical barriers in order to get to vaccination clinics. So discussed things like couldn't get a ride to these clinics, maybe didn't know where the clinics were, had a hard time finding time in the day to be able to go get vaccinated. But then there were also some concerns about the vaccines themselves, concerns with respect to long-term side effects with the vaccines, and even concerns about mixing and matching vaccine doses. And finally, another barrier or hesitancy that came up was the infringements on my rights and the mandates that have been put in place for individuals to be vaccinated. So we thought this was a great place to start in our webinar to be able to address some of these top hesitancies, provide some accurate and up-to-date information, and also to share stories and perspectives from other students within the community who have had that confidence and motivation to get to get the vaccine. And to do that, we have invited a group of panelists, both experts in the field, scientific experts, those individuals, healthcare professionals who are right at the front line in our mass vaccination clinics, and also some of the students who have gone through the process and have gone and addressed some of these hesitancies themselves. So with that, I'm going to, I believe, next slide. Oh, sorry, one more slide. I apologize. One more slide. Another point that did come out from the survey was that although amongst those who were unvaccinated at the time that they took the survey, it was good to see that almost 70% of them did have intentions and did plan to get vaccinated over the next year. However, there still remained about 12% that were unsure and 15% that said they would not get vaccinated. Of those that were unvaccinated, 32% of them said that they needed more education or more information about the vaccines themselves. And as I mentioned earlier, that is the whole reason why we are doing this webinar today, so that we can provide accurate and up-to-date information for those individuals who still need more information to build that confidence to go and get vaccinated. And so we'll leave you with the message that education is key, and this is what we're here to do in the webinar today. And so at this point, I will pass it over to my co-host Nellie, who will begin the discussion with our panelists.
Thank you, Dr. Cavallo. And as she mentioned earlier, my name is Nellie Bordigno. I'm a fourth-year biomedical science student, and I'm happy to be here today co-hosting the webinar. So to start, I'm going to transition into topic 1, which is focused on expert and frontline perspectives. So we'll start off with 2 out of the 5 of our panelists today. We have Dr. Lisa Porter. She is a professor in biomedical sciences and the executive director of LeeSpark Health Institute. So thank you for joining us today. And then we also have Tashbeen Saeed, who is a registered nurse and also an alumni of the University of Windsor. So we're very happy to have both of them here today, and they will be touching upon any expert and frontline perspectives, as I mentioned. So I guess to start off the conversation, I will direct the first question to Dr. Lisa Porter. So could you provide any general updates regarding COVID-19 vaccinations, such as booster shots, the 5 to 11 year populations, and so on?
Yeah, first of all, thanks for having me. It's always great to attend these events, and we can never get too much information out there. With regards to updates, the literature for COVID-19 and vaccinations continues to grow by the day. It really is amazing to see this data coming in. And I guess the 2 big things that have happened over the past month or so is the data that has come out to support the authorization of Pfizer or BioNTech for ages 5 to 11. So that data, there was 4,700 children across Finland, US, Poland, Spain, where 3,100 of those children received the vaccine, and that was compared in proper clinical trials against placebo controls. There's a couple things that were changed moving out into younger children. So first of all, it was still 2-dose vaccine with 3 weeks apart. But something people should know, that the dose was changed, so the dose is lower for children. And also they changed a little bit of the formulation. So it was changed to a buffer, a salt buffer, that's a little bit more stable. So this allows for sort of doctors' offices and whatnot to be able to give the vaccine and keep it a little bit more stable. And that data showed that the vaccine was effective. So the ability to prevent children from getting COVID went from, it was about 91% effective, which is really comparable to ages 16 to 25. And there was no serious adverse events, especially no death within that population. The side effects were sort of, soreness at the injection site, fever, nausea, things that we associate with vaccination, and those largely lasted 2 days. And the other big sort of really new thing coming out since early November is the emergence of the Omicron variant, which in science we call that B11529. And this really is this variant has many, many mutations. So some of these mutations are the same ones that we've seen coming out in other strains. So it's kind of accumulating all of these mutations. This started in South Africa. And at the time, we know that vaccination rates were very low in Africa. And we know that sort of equity has been an issue, and this is now coming around to sort of bite us, because we knew it was a possibility, right? Leaving countries unvaccinated allows for the virus to mutate. And now the literature is really starting to look at, how rapidly is Omicron spreading? What's the transmissibility of it? Is it going to be equally susceptible, and are vaccinations going to be able to protect us? And on good news, we know that Moderna and Pfizer are both working hard to prep new vaccines should Omicron turn out to be less effective in protecting us. Yeah.
That's awesome. Thank you. Yeah, I think a lot of people don't know that every time someone gets COVID, like the vaccine or the virus mutates, or there's a different variant coming out to transmit to someone else. So that's a really good point. For the second question, we would like to ask you, how was this vaccine developed so quickly? So that was one of the big misconceptions and hesitancies that we noticed in the survey as well.
Yeah, so one of the things that causes science to move slow is the funding, first of all. So getting adequate funding to do studies is one big barrier. And that was, something that people threw money at COVID. Another thing is red tape. And so, it was beautiful to see countries work together, governments lift red tape to allow these studies to happen rapidly. Things that, for researchers like me, we are constantly having to fight against red tape in other areas. Another one is about the number of people that were infected. Often, in fields like cancer, for example, we don't move quickly because we have to wait for enough patients to be able to get the disease, and you have to follow it for a certain length of time. And so because we had so many people infected, you're able to get large populations that could be studied rapidly. And another thing is about the types of endpoints that you study. And so the things that we need to study, we've been studying vaccination forever. Long-term effects of vaccination are your immunity. And so, that we are still studying, how long is our immune system able to keep up from the vaccine? That's something that's still coming in. But really for vaccination, the side effects that you're looking at, because the vaccines really disappear relatively quickly. And so we know that the effects of vaccination are relatively quick. One is a very quick effect, so within hours or a day, and the other is within, 2 months, really, even quicker than that in reality. And so unlike other diseases like cancer, where you've got to wait 3, 5, 10 years for your effects to come in, these we can collect the data very rapidly. So all of those things together really just equate to, the science and the support that COVID got allowed for these studies to happen rapidly.
Yeah, absolutely. And then just to follow up to that, you talked about briefly about the long-term side effects, if any. So we noticed that was also a big concern in students, like worrying about any long-term side effects years from now from getting vaccinated. So was there anything you could say from an expert perspective on that?
Sure. So the vaccines that are approved in Canada, we know that they only last in your system. Something like Pfizer, for example, is very rapidly degraded. So it's a quick signal. Vaccines work by tricking your body to think that you have the virus, and then it's rapidly degraded. In fact, it's a safe way of your body developing its own natural immunity. And so really the effects of vaccine are your immune system mounting. And so that fever that you get is your immune system. And that same thing would happen if you actually were to get the virus, except if you get the virus, it's able to replicate itself. It's able to hang around for a lot longer. So vaccine is a safe way of showing your body the presence of a virus, basically. We know we've been studying virus or vaccines for many, many years, decades. And so we know that long-term, that the effects of this is really your body having antibodies. And these things don't stay on forever, right? Your body sees the signal, you mount a response, and then that response goes down, and it just sits there and wait. And really what it's waiting for is to see the virus. And once it sees the virus, now it's prepared to fight it. And so that's how it works long term. There are no law. It's not like a drug, really. It's actually using your own body. What we don't know long term is what the effects of having a full-length virus that's able to invade into your body and replicate and cause all sorts of effects. And so the long-term effects of COVID itself are something that are really a very big concern.
Thank you. We'll now direct the next question to Tashveen. As I mentioned, he is a registered nurse, and he also worked at the vaccination clinic during the peak of COVID. So having worked at the vaccine clinics, Tashveen, what are some of the vaccine hesitancies that you have experienced in the younger populations?
Hi, everyone. Thank you, Nelly. So I'll just quickly introduce myself again. My name is Tashveen Saeed. So I was actually hired by Erie Shores Health Hospital to be part of a team called the Community Response and Stabilization Team. So we worked at we were deployed at multiple different mass vaccine clinics, as well as we worked at multiple different pop-up clinics in the Windsor Essex area. So I got to see a variety of populations and younger populations. And the one thing I found was, to be fair, there is no single one identity to the youth population. Everywhere you go, it's a little bit different in terms of, vaccine attitude, cultural beliefs, religious beliefs, or even, just the general perception about vaccines through family or friends. So there is no one campaign, I think, that we can that can focus on all the hesitancies. The general things we found, or I found, in the youth population were things like fear of needles. That was a really big one. Fear of side effects, invincibility. A lot of youth people had that complex. We touched upon, I think we touched on that as well. And so just people thinking that, they don't need the vaccine, they have sufficient and a sufficient immune response to fight it on them by themselves. And also physical barrier like access to vaccine clinics. And honestly, some people were on the fence and, they just didn't have the motivation to make it to the clinics. We found that as a lot as well. And then the other thing was, fake news and misconceptions related to the vaccines. One big one was a lot of people were worried about like infertility issues. And I think the common denominator, again, in all of the above is a lack of education. So young adults, I think a lot of them, they're on the fence whether they should get the vaccine or not. And they have a lot of questions that they need answered. So this is a really good initiative, I was saying, for people to come out, and that is our target audience here, to answer their questions. But there is obviously an amount of people, although small in number, that no matter what you tell them, they will not get the vaccine, right? So just something to think about as well. So the one thing is the fear of needles I found was a pretty big one in youth population. And I want to say that for the nurses who are working there, and even the student nurses that are working at the vaccine clinics, they are very well capable of taking care of that fear. So what we were taught in school was not only how to give a vaccine, but also we were trained in, I guess you can say, like customer service and patient care. So we know how to make you feel comfortable. We know how to talk to you and kind of distract you, from your fears. And it's a really great experience. And most of the time, you won't even feel it. You'll be talking to me, you'll get the shot, you won't even know it until I'm done the conversation. And then you'll go home. It's just like that. So we are very professionally trained. And in that case, like all you have to do is just let us know about your fears, right? Because that's what we're made to do. So yeah, that's the big one. The other ones, like fear of side effects, I think we touched on that quite a bit now. So mostly mild side effects, and you feel it, and maybe you feel it for a day or two, but as fast as it comes, you won't even realize it. The next day it's gone like nothing happened. And yeah.
Awesome. Yeah, when you were saying like you don't even recognize the needle going in, like I remember when I got mine, I remember the flu shot honestly like felt worse for me. So I know for sure the nursing program at U Windsor trains you guys so well for that, and I'm sure every program at the university too. But the fear of needles is definitely very prevalent in a lot of younger populations, like you said. So I'm sure that's assuring for a lot of students to hear that you guys are there trying to make them feel comfortable, not a scary process. Yeah, Ryan says, I was so surprised I didn't feel the shot at all. Awesome. Well, thank you, Tashveen. The last thing I wanted to ask you about that was there was also something younger people were coming in wanting like a preference, Pfizer or Moderna. Do you think you could talk about that issue when you had someone asking you for one vaccine over another?
Yeah, so I think Dr. Porter would probably know a little bit more about the science part of it, but what it really is Pfizer and Moderna, the two that we were giving out always, they're what we were explaining to people was that they're actually the same technology, just a different brand of vaccine. So it's almost like how they have Tylenol and other medication brands that have the same like medicinal ingredient in Tylenol, which is like acetaminophen. So it was just one or the other. There wasn't too much of a difference in terms of the protection that are offered.
Thank you again. All right, well, with that, that was all of the questions we had for Tashveen and Dr. Porter. So I will ask Bhavya, Jasleen, and Patrick to turn on your cameras, and we're gonna move on to topic 2. So here we'll be discussing from a student perspective, any barriers and motivators that these 3 panelists had in getting vaccinated and their process through it. So I'll let you guys briefly introduce yourself. If you'd like, we could start off with Jasleen.
Alrighty, so thanks for that, Nellie. It's great to see you all. Hello, my name is Jasleen Dale. I'm the president of the UWSA, and for some context, I am in my 4th year of political science here at U Windsor. So it's great to see you all.
Thank you. We'll go on to Bhavya.
Hi, everyone. My name is Bhavya. I'm actually studying data analytics for now in St. Clair College. I'm also working with the Student Representative Council as a director. So it's nice to meet you all.
Thank you for being here. And lastly, Patrick, you can introduce yourself.
Hi guys, my name is Patrick Lozon. I'm a 3rd year mechanical engineering student, and I was lucky enough to be selected the winner of the U Windsor Vaccination KO COVID campaign.
Awesome. All right, so we have a couple questions for you guys today. I'm sure everyone's eager to hear what you guys have to say. So first, I'll direct the question to Jasleen. The question's the same for all 3 of you guys, but I'll let Jasleen answer first. So did you experience any barriers when deciding to get the vaccine? And what ultimately motivated you to get the shot?
All right, thanks for the question, Nellie. So for me, it came down to a few factors ultimately. So not only did I get vaccinated in order to protect myself against COVID-19, but also to protect those around me. At home, I do have people who are at high risk that I live with. And, you know, seeing as they are part of a vulnerable demographic, I felt like it was part of my responsibility to get the vaccine and make sure that I was basically doing my part in flattening the curve and protecting our community and the people in my life that I care about. Not only within my own household do I have high-risk individuals, but also some of my friends who have pre-existing medical conditions that put them at high risk with COVID-19. I felt like I was doing the right thing to not only protect myself, but again, those around me too. And then another reason that motivated me to get my vaccine was the possibility of being able to return to some level of normalcy in life. After spending so much time away from friends and family members, the route of getting the vaccine to be able to see those around me who I care about was such a huge reason for me to get my vaccine.
Awesome, thank you. And I'm sure the UWSA office is nicer when there's people in it. All right, so I'll direct the same question to Bhavya. So did you experience any barriers when getting your vaccine, and what motivated you to get the shot?
So as what Jaslene said, that it was like one opportunity to go back to normal life now, that since I'm from India. So I came to Canada for international exposure, and then because of COVID, everything was closed. We had online classes, so there were no part-time job opportunities or like any job opportunities as such, if I talk about. So vaccine was one way, we all could go back to our normal lives, how we used to be, because there's no point, sitting inside a room and like staying away and without socializing. So that's why.
Awesome, thank you. Yeah, I'm sure it was awesome to come to Canada and have that opportunity too. All right, and then we'll ask Patrick the same thing. So did you experience any barriers when deciding to get the vaccine, and what motivated you to ultimately get your vaccine?
Yeah, so in terms of the barriers, I'm immunocompromised myself. I have Crohn's disease. So I ended up actually having access to the vaccine early. So it was kind of nice just to get it just to like get in front of the line a little bit. And the vaccine clinic I ended up going to was actually, I have one that's basically like a block away from me. So it was like super, super easy, like couldn't ask for it to be any easier than that. Second shot was just like a quick drive too, and that was again, it was such an easy process. Like it was super easy to find it online and everything. And then just in terms of my motivation for getting the vaccine, I'm lucky enough that I don't live with anyone that's super high risk. I don't have a parent that's elderly or that has a serious medical condition. But I just kind of looked at it from like a broad sense of obviously getting it for selfish reasons. I mean, the main thing is that like it protects myself. I mean, I definitely want to, especially being an immunocompromised individual. Like that was obviously a big factor. But also, I know the community component that you need to have in terms of the vaccination campaign as well. COVID doesn't really get much better if only 10%, 20%, 30% of people get the vaccine. We've kind of seen throughout history that it's required, like the vast majority of people to get it to actually return, not just to normal, but return to a safe normal as well, where we can all like gather again, have all those normal aspects of life again, where we can all socialize, we can all like return to school and everything, but we can do so safely and not have to worry about the effects of COVID. And honestly, getting the vaccine too, it was such a quick and easy solution to it. Like it's kind of amazing that you can just get like basically like a painless, quick, like easy shot that's literally free. I mean, I would like if I had to, I would have paid money for it. I'm glad you don't. I don't think you should have to, but I would have if I had to. I mean, it's kind of amazing that you have access to something like this for free. And yeah, I'm just excited to get back to normal and just seeing everyone like kind of I'm on campus right now. Actually, I'm in the library, but kind of just seeing people around campus and seeing like life return to normal and that, and seeing people's face again. Like it's good to see everyone around.
Thanks, Patrick. Yeah, it's awesome that you did it for yourself, and also the bigger picture, the community effort. I think that's really important in this whole process, is that we all think of it as like one step closer to returning to normal eventually. All right, so with that, that wraps up topic 2, barriers and motivators, and we'll move on to topic 3. So if Dr. Porter and Tashveen, if you guys would like to turn your cameras back on, these last couple questions will be directed to everyone. So the first will be directed specifically to Dr. Porter and Tashveen. So since receiving the vaccine, what are some key factors or events that have boosted your confidence in the vaccines?
You want to start? Yeah, you can start.
Oh, okay. All right. So for myself, first and foremost, like just seeing the numbers of cases go down in the city, seeing our hospitals, getting a little bit more comfortable. Because, when I was at the hospital as a student, I saw everyone just so burnt out, so tired. So it was nice to see, a little bit of relief. And then I think just recently, even this summer, I think was it CDC actually, or the FDA actually like approved the Pfizer vaccine like officially, or so that was something else to see as well, with full confidence that it's being manufactured safely and administered safely.
Thank you.
Yeah, I
Dr.
guess I
Clair,
would
would
just
you like to
reiterate
follow
that
up?
point. I mean, I think the fact that we're seeing hospitalized and ICU cases that are primarily unvaccinated, or, the small percentage of people that are maybe not able to mount a healthy immune response, but this just goes to really show us the power of vaccination. And I think, again, about the point about Omicron, these things emerge because of low vaccination rates in other areas. And so I think just seeing the protection that the vaccination is bringing to our country, but knowing that we have to do better.
Thank you both. So the second question is going to be directed to Patrick, Jasleen, and Bhavya. So how has your decision to get vaccinated impacted your personal and professional lives? So we could have Jasleen answer first if you're ready.
Yeah, for sure. Thanks for that, Ellie. So I'll speak to more so my professional life in this context. So there are some things that I got to experience that I don't think I would have been able to if I did not receive my vaccine. So for example, last year during my time with the EWSA as VP Student Life, I was not able to experience much of the in-person aspect of the job, which was a huge part of it, which included hosting in-person events that we would normally host, being able to enjoy time in the office, and so much more. This time around, though, I'm grateful that I am able to take part in in-person meetings, work out of the office, see students on campus, coworkers, and basically foster these connections that I think are hard to foster at times in a virtual setting. It's always such an amazing thing for me to be able to see students physically present on campus, which is something I've personally missed a lot during the pandemic. So, yeah.
Thank you. Bhavya, would you like to speak next?
Sure. Jasleen is actually covering all the points. I totally agree that getting to interact with the students, since I am also like working as a director. So it's good to see students around in campus, like have lectures like in person right now. And it's like that's like more professional side, but yeah, personal side as well. I really love to go outside, and getting vaccinated was one of the best decisions that I've taken. So I can go out, I can hang out with my friends at home, at restaurants, everywhere actually. So that's the most like best part out of it.
Thank you. For sure, it's nice like getting back to normal life and actually being able to go out and see people at a restaurant too. Like even if they're not your friends, it's nice to finally see things getting back to normal. And lastly, Patrick, we'll have you answer the same question.
Yeah, so I'll start with kind of some fun news. Is I'm actually going across the border this weekend. So going for the weekend and gonna go see some sports games and just go shopping and have some fun over there. So obviously that's not possible if I'm not vaccinated. Just besides like the government rule in general, it just wouldn't be safe to if I wasn't vaccinated. That's kind of why I don't want to stress like, oh, I can go to a restaurant, and if you're vaccinated, you can't go to a restaurant. Like I'm not thinking of that in terms of like the vaccine passport or whatever, just in terms of like the population being vaccinated like allows that to be like a safe space. So that's why like I think that's like the major point there is just the safety of getting vaccinated has allowed me to return all those social aspects. And then like Jeslyn and Bavia were saying too, like I'm a full-time student right now, so just being able to access campus facilities again. Obviously, I'm in the library right now. I use this a lot, having access to like the CIW, having access to some other buildings as well. It's definitely helped. I like to separate my personal life and like my work life quite a bit. So it's nice being able to get out of the house, have that separation from like home and work, and just being able to come here, socialize, but then also like having the space to study as well. And then I'm also for mechanical engineering, I'm also in the co-op program too. So I mean, that's something that's really benefited me just in terms of kind of turning the tide on COVID with this vaccination effort is having the co-op opportunity. Because I know when co-op first began talking to the year above me, they didn't get the opportunity in their summer semester to actually have a co-op placement. So with the vaccinations turning the tide on COVID, those job opportunities have opened up again. And I'm lucky enough too, where my job is actually going to be in person instead of online. I think that'll be like a lot more beneficial experience for me. So I'm really thankful about that. And then I'm in co-op during the winter, but then in the summer I have I'll be back to a full semester. So I look forward to very likely being back full-time on campus for in-person classes.
Awesome. Thank you, Patrick. So we have a bunch of questions in the chat. The first one I see, it may be best for me to ask it now from Dr. Porter. For any of the panelists, do you think you'll be getting the booster shot?
I can answer the question. I was thinking about it actually, because of what Dr. Porter said earlier, that the long-term effects of the effectiveness of the COVID vaccine is also still under investigation. And I got it pretty early into the pandemic because I was working actually on a COVID hot unit at the hospital as a student, like early February. So I'm definitely waiting for a chance to get the third vaccine now that I'm starting work again.
Awesome. Would anyone else like to add to that, Patrick?
Yeah, so I actually I'm eligible right now because I'm immunocompromised, so I fall under that category. So I actually have my my booster appointment set for Monday. So yeah.
Awesome.
Yeah, I would add that, like, for immunocompromised and for aged patients, you know, your immune response is likely to go down faster. I mean, the data shows that. So obviously the booster's really great resource that is starting to come out. And the data does support that even after 6 months of your second dose, that neutralizing antibodies start to go down, especially effectiveness against the different variants that are emerging. So as we're seeing more and more variants, the need to have a booster is becoming even more prevalent.
Yeah, absolutely. We actually have another question for you, Dr. Porter, from Ryan. How has COVID-19 impacted lab opportunities for undergraduate students?
Yeah, I mean, I think for students in general, some of the students noted these some of these things, but I think there's been both positives and negatives. You know, I think we've seen technology evolve in ways that it's not going to go backwards. You know, like it's allowed for some accessibility to, you know, the information. We started a student network where students learn a lot of the sort of theory behind what we're doing online first. And I don't think I'll ever take that away. I mean, it really did help them understand when they get into the lab how to do things a bit better. You know, they came with a different perspective. But I mean, the negatives are obviously that experiential learning that we heard from some of the students, and the environment, the camaraderie of, you know, having all your friends around you in a lab environment, like learning in general. You know, there's hills and valleys. And I think one of the beauties of people being together is that you can support people when they're going through a difficult time. And being online really prevented that. So I think that was a big sort of negative for being online.
Yeah, I'm sure every student can attest to the social detriments of being online, like not seeing your friends in your lab or even meeting new students, like as a first or second year. That's really where a lot of students make those connections and join those clubs. And it was definitely a lot more difficult given the online environment. So we have another question. Maybe Bhavya, you could answer this one. What would you say to a family member or friend who is hesitant or didn't want to get vaccinated?
Okay. So honestly, vaccine is like, it's important not just for like you to be safe, but for the people around you as well. It's like, if I talk about my family as well, my grandparents were the first one in my family to get vaccinated, and I was just waiting for my turn to be eligible, because back in India they started with senior citizens and then they moved to younger people. So that's the reason, like when I came to Canada, I got vaccinated over here, not back in India. But yeah, it's like important to, because at the end of the day, you don't know what effects the COVID is going to make to your life. So it's better to, if there is a safe zone, you get into that safe zone, and so that everyone can move forward and just not, stay still and stay stagnant at one point.
Yeah, thank you for that. Did anyone else want to add on to that response? Yeah, Patrick, go ahead.
Yeah, so I kind of had like multiple people message me kind of throughout, like even before the vaccine came out, just kind of like the preliminary, like before like the vaccine, while it was being developed, people kind of had a lot of questions about that. So I think it was just trying to take like a soft approach, but just being honest, I just tried to, I'm not an expert myself, so I try to link them to some professional resources about it. And some of the people like took that advice, and some of the people still aren't vaccinated to this day. I mean, at the end of the day, like sometimes there's nothing you can do, but at least like extending that hand and making an effort. Who knows? Maybe they'll change their mind in the future, and like it's not obviously going to resonate with everyone, but as long as it touches a few people, then you might as well go and try and make the best effort out of it.
Yeah, absolutely. Was there anyone else that wanted to add on? If not, I'll ask another question.
I can just add one point in that I think it's really important to recognize, I think it was Tajleen that said, there's lots of different reasons why people might be hesitant. And so to really acknowledge that, that their fear is probably really real. And it's important to take it seriously, to, recognize and not mock them, or try to call them down because of it. Because I think people are just looking for information, and there's so much misinformation online, and things that are like, really scaring people. And we know that it's misinformation, but this is something, especially when it comes to vaccinating your children and things like this, people really, this is a true fear. So I think it's important to approach it in that way.
Yeah, I really resonate with that response. Like starting out the whole conversation series with the student team, that was like the whole point of why we wanted to put out these hesitancies and make it into like a conversation student to student, because like these misconceptions and the hesitancies are something that we wanted to address as not just like brushing it aside. Like these are real things that people believe, and we wanted to have it be more a conversation where you can learn rather than demanding someone to get the vaccine, because it shouldn't be like that, right? We have another question from Loretta. Were any of you worried about what your friends or family would say about you getting vaccinated? Patrick?
Can Yeah, so in terms of from my perspective, I'm lucky enough that I didn't have kind of like anyone in my circle that would like look down on me for getting the vaccine. Like everyone was like very encouraging about it. But I do have a close friend whose parents are very hard set against the vaccine. So that was kind of something difficult to manage there. He was unsure about it, and me and my group of friends that are friends with him as well, we encouraged him to get the vaccine even though his parents were against it. But obviously like it's difficult when you have like that parent like child relationship. It can be difficult because he knew that his parents would be upset if they knew he got the vaccine. So we encouraged him to get it, but we obviously made sure, basically like kind of kept the information from his parents. We made sure that they didn't hear about it. We didn't want like us encouraging him to do a good thing. We didn't want that to get him in trouble in the process. So we just tried to do it in a way that was like we found a way to like we helped him with like booking resources and that way he kind of didn't have to go through his parents. And we kind of like figured out an excuse for him as to like why he was like going to get it and stuff like that. But we ended up like doing it in a way that like kind of like protected him. So
That's really awesome because I'm sure if it wasn't for you guys and your friend group, he probably wouldn't have gotten vaccinated in the end. So, yeah, that's an awesome story. Did anyone else want to respond to that question?
I can share kind of what I noticed in my time when I was vaccinating. I found that, um, at the beginning, when a lot of people weren't sure if they wanted to get the vaccine or not, they were waiting to see if other people would get it, their friends and family would get it. So I think what you say to your friends, or especially um, like who's close to you, those closest to you, if you guys like kind of like follow the leader, right? People have a tendency to do what their friends are doing. So when people were coming to the vaccine clinic later on, I found that a lot of them were telling their friends to come and their relatives to come and so there was that tendency, and then there was also the tendency other people have, to go against the crowd. So there's always that too. But I think mostly um, the best advertising for vaccine was coming from people who got their vaccine and telling other they know that are close enough to get the vaccine.
Awesome. Yeah, that's like the whole purpose of this project too, right? Is to like spark that confidence in other students and share our stories so that they can resonate and relate to that and emphasize with the fact that like we're all in this together. So yeah, thank you for that. Before I open up the questions to everyone else who still has a question, there's one from Shabam in the chat. Dr. Porter, is this the endemic? Like, do we have to have more booster shots if there will be a new variant that could be more dangerous than Omicron? So I guess he's asking, will there be more than just this third shot?
Mm-hmm. I mean, I think that the more that the COVID is allowed to replicate, there's always chances that it's going to mutate. This is what viruses do. It's literally their job is to find ways to keep themselves producing. And that's why when people say, it doesn't kill everybody off, well, that's a good virus because good viruses don't kill their host off. They like to produce themselves more and more and spread. And so that's what this virus is trying to do. That's its job. And the worst thing is for us to get vaccinated because that's putting a stop to it. So I think, right now we do have tools that are slowing it down. That's the best thing that we can do to do our part to keep it from replicating. I think also, like I hit on the equity piece, and even within our own country, you heard some people can't get to vaccination sites. I love to hear from the frontline people that are really going out there and getting people vaccinated. But that's the best thing that we can do. I mean, having the vaccine companies working on the next stage, looking at those variants that are starting to emerge. The virus finds good ways that it can change its sequence. And so it's hit on the easy changes, and those ones we're seeing are continuing to sort of accumulate. So as the vaccine companies can already look at, let's make a new vaccine that's going to be able to block certain mutations and that will make it better. I think that's going to have to happen. But really it's up to us to get more numbers vaccinated faster so that we can prevent the accumulation of more and more mutations.
Yeah, for sure. And that's good to hear that like the research is almost coming one step forward to prevent or stop those new mutations that they're anticipating.
Yeah, I mean the technology, this mRNA technology is really amazing. And now sort of the challenge is that they can produce a vaccine within 100 days. That's kind of what are trying to do. Let's say we can get a vaccine, get it through certain levels of testing within 100 days, which before, I mean, this would have been not even heard of, but it's kind of, this is the pipeline kind of that they're hoping to get.
Yeah, that's incredible. All right. Well, with that, I will ask the crowd if you have any other questions to ask, please do so now. Dr. Cavallo has some closing remarks and some final slides to share with everyone.
Yeah, thank you, everyone. Thank you to all the panelists. What great answers to some of those wonderful questions I see in the chat. And I see Dr. Porter also answered some of the questions with related to different languages and translations of different information. And of course, if English is not your first language and you feel comfortable reading your own native language, then absolutely there are resources out there as well. I see just one final question here. Jacqueline is asking about how do you feel about your choice to get vaccinated? So you could do a thumbs up or a thumbs down. Hopefully everybody has their thumbs up. Awesome, great job. That's what we love to see, that everybody feels very confident in the choices that they've made. And also that hopefully through this webinar that you will have learned and gained some tools yourself to be able to talk to others, have that conversation with your family members, your friends, other members of your coworkers, colleagues, peers, members of the community about the COVID-19 vaccines. And if you still have questions that you need answers to, the WeSpark Health Institute has a resource hub, and in this resource hub on their website, www.wespark.com, you can find specific information related to, first of all, in general, COVID-19 information, information related specifically to vaccines, and also a spot where we are hosting all of our information with the Students Sparking Vaccine Confidence. So if you visit the website and you click on either one of these boxes, you will get a slew of links and information that you can go to. And again, these are credible sources. We have looked at both provincial, national, international websites and sources for that reliable information. And we have experts that are going through that information to ensure that we are providing as much up-to-date information as possible. And I see Ryan has put the link into the chat, so you have an easy access to that information. So keep looking at it. We're always updating it and putting new things on there as new things come about, new information comes about. So that's the one piece I wanted to leave off. And then also the second piece in the next slide is for you to join our COVID-19 Vaccine Conversation series. So in addition to these webinars that we will be hosting throughout the next few months, we also are leading forward in conversations on social media. And so these conversations are, as you can see, they're kind of comic strip based, something a little different than maybe what you've seen already in social media with respect to COVID-19 vaccines. And these are your common conversations that you may find students having and young adults having with one another about the COVID-19 vaccines. And so again, great information, great and just easy, creative way for you to get involved and just read the conversations and hopefully learn as well some additional information that you can use to either help boost your own COVID-19 vaccine confidence, or to help others boost theirs. And again, you can find all of these on our social media sites, and our handle is @WeSparkHealth on Instagram, Facebook, and Twitter. So we hope that you will, if you're not following WeSpark, that's the first step. You need to follow WeSpark. So go to those social media sites, follow WeSpark, and join that conversation. And we've got a whole set of series that are COVID conversations that are continuing to be coming forward over the next few months as well. And then finally, our last slide is to give you the final reaction to today's webinar. And hopefully you all have had an opportunity to be able to, gather that information that we've just provided, and hopefully that has increased your COVID-19 vaccine confidence. So let us know, thumbs up or clap of a hand. Thumbs up, yes, I feel better sense of trust in the vaccines. Clap of the hand, I'd like to check out some additional resources to feel better. So, and that's totally fine. We absolutely want everybody to be able to have access to those resources. I'm putting my thumbs up because I even learned a few things today as well. So I love that. And again, building my own trust and confidence in the COVID-19 vaccines. Awesome. I'm seeing a lot of thumbs ups, and that's wonderful to see. And then finally, we will leave you with our final words, and that is that of Confucius saying, education breeds confidence, confidence breeds hope, and hope breeds peace. And that is what we hope that we have tried to achieve here today in our first webinar of a series of webinars that we will be doing over the next few months at We Spark Health, again, following us on social media. Thank you all for joining us today. Thank you for our panelists that have come on and shared their expertise as well as their experiences, both at the front lines as being a recipient of COVID-19 vaccine, as students and young adults within the Windsor Essex community. Thank you to all of our volunteers who have worked so hard over the last few months, helping us build this wonderful campaign, and in particular, helping us build our webinar here today. And finally, to my wonderful co-host, Nellie, who's done an awesome job leading that conversation today. Thank you, Nellie, for joining us and taking on that leadership role as well. Thank you all, and as well, continue to follow us. We will continue talking. We'll continue building COVID-19 vaccine confidence. Thank you, everyone. Have a great evening.